seated. You may be seated, stage party. Okay. Well, good afternoon and welcome to the class of 2022 Bowl of Hygeia ceremony. It's so lovely to see all of you. Most of the class was able to be here tonight, so we're thrilled about that. I have to admit, I didn't recognize some of you because it's been almost a year and a half since I've seen you in person. And the last time we were together like this was the white coat ceremony. So it's great to have you here. All right, so I'm going to ask people to silence their mobile devices. And I'm going to go ahead and get started. For those of you who don't know me, I am Mary Euler. I'm the Associate Dean of Admissions and Student Affairs for the School of Pharmacy, and we welcome our guests to this event as well. So I'd like to talk a little bit tonight about the history of the Bowl of Hygeia. You may be wondering. I have my snake here because Hygeia, of course, you will learn about the serpents and the Bowl of Hygeia. So tonight's ceremony takes its name from the world of Greco-Roman mythology. In that ancient culture, most believed that nearly every aspect of life was influenced by one or more gods or goddesses. The treatment and prevention of illnesses was certainly no exception. Hygeia, the namesake for tonight's program, was widely regarded as the goddess of health and was well known in mythology as the daughter of her physician god, father Asclepios. Hygeia accompanied her father as he traveled about treating the sick and injured, but her primary role was compounding the medicine and then offering it to the patient. Her name remains with us today as the root word of hygiene, and in numerous surviving artifacts, Hygeia is usually shown carrying her outstretched hand in a shallow bowl, which was called a phial, which is the forerunner of the name for a pharmaceutical word of vial. Into this, Hygeia would place the remedy that she had created and then administer it to the patient. The central part of the image depicted on the front of your program was the sacred serpent, usually shown intertwined around Hygeia's arm with his head poised above the rim of the bowl. The inclusion of this image of the serpent was not done for artistic value. It was quite intentional. The serpent held particular significance in the ancient world. Specifically, they were believed to possess and transfer the knowledge of the healing herbs or medicines, or what they were called by the Greek pharmakon, which of course is the word that we use now today for pharmacy. In this process, serpents were symbolically able to pass the healing powers of the medicine to the patient. They believed that snakes never slept, thus enhancing their image as the perpetual guardian of one's health. Indeed, these snakes were held in such high regard that typically one or more rooms in the temple of healing were dedicated solely for the care and feeding of the resident serpents. Certainly glad pharmacy has changed. Such rooms were typically filled with cages of rodents who would be fed to the snakes in hopes that a well-fed snake would never stray far from home and always be on call for the patients. While belief in the mythological powers of Hygeia have been lost over time, the image of Hygeia's bowl and the serpent have survived up to the present. The symbol is used yet today throughout the world to depict the art and practice of pharmacy. As for the link between Hygeia and the purpose of tonight's program, students about to be recognized will soon make a significant change in the focus of their education, moving from the classroom to the real world of patient care. To this, you will add the knowledge, wisdom, and skills of your experienced preceptors. The end result will be the continual passing of knowledge to the next generation of practitioners to improve the health of those we serve. As a reminder of your academic roots, each of you will be presented with a pin with the flying WV logo, one of the most recognized collegiate symbols in the United States. Congratulations to the class of 2022. May you wear this pin with pride as you carry with you the ancient traditional healings of Hygeia. It is now my pleasure to introduce Benjamin Perry, a native of Morgantown, West Virginia, and the president of the School of Pharmacy class of 2021, who will provide a student perspective. Ben?
Good afternoon, faculty, honored guests, and most importantly, the West Virginia University School of Pharmacy class of 2022. Thank you for this opportunity to speak with you all today. Congratulations from my class to yours. You should be extremely proud of what you've accomplished and all you've been through. Not only have you completed the didactic portion of your curriculum, but you have done so amidst a pandemic. I could go on and on about how you've got to roll with the punches and be adaptable, but you should all be pros at that by now. This past year has stretched all of us, but I believe it has equipped you more than any class in the recent future to take on the ever-changing world of pharmacy. As you embark on this year of experiential learning, I urge you to keep in mind 3 ideals. 1, maintain balance. 2, embrace the unknown. And 3, make the most of every opportunity. Maintain balance. Most of you have spent the past 18 to 20 years of your life in school. For some of you, this is your first taste of working full-time. My advice to you is to make this upcoming year a year of transitions. Prepare yourself to take on a new job, move to a new town, and overall start a new chapter in your life. Try to form new habits now while you still have the comfort of being in school. Understand that although being a pharmacist is a great career choice, it's not the end-all be-all of our lives. Therefore, take this time to invest in the things that matter most to you and maintain balance between your friends, family, career, and hobbies. Embrace the unknown. As you start your rotations, you'll quickly learn that you don't know everything, so be ready for it, but don't be afraid of it. I spent half of a rotation being afraid of looking unprepared, and ultimately this fear is what actually made me look the part. There's nothing wrong with saying, I don't know, but what is wrong is not learning from that situation. You're about to gain at least 8 new resources who are ready to give you a lifetime of knowledge and experience to fill in the gaps that you just can't learn in the classroom. So as you move forward, if you don't know, then ask. If you forget, then relearn. If you remember, then reinforce. And if you know, then apply. And lastly, make the most of every opportunity. Every rotation is designed to give you a specific experience and allow you to practice specific skills. However, you don't have to let the parameters set by the school be your endpoint. Make your rotations unique by asking to experience more. If you don't think one of your rotations will apply to your future practice, then take that opportunity to make it so. Observe the management, the workflow, and any other characteristics that you can take on yourself as you become a practicing pharmacist. On top of that, never forget to simply have fun. Some of you get the chance to travel to new and exciting places to complete your rotations, while others are staying in West Virginia. Wherever you go, make memories that will last a lifetime. Spend time with those you love. And throughout pharmacy school, our classmates have become our best friends, but most importantly, they've become our family. They've supported us through the highs and the lows. So make the most of every opportunity you have left with them. In closing, I want to leave you with this quote from Malcolm X. Education is our passport to the future, for tomorrow belongs to the people who prepare for it today. Once again, congratulations, West Virginia University School of Pharmacy class of 2022. And best of luck as you endeavor onwards into your P4 year and beyond. Thank you. I now want to welcome Dean Bill Petros to the podium to offer his insights into the next phase of your education.
Thanks soon to be Dr. Perry for the excellent speech. Don't quite have that diploma yet. I will start out by saying I'm sorry we have to use a rubber snake today. The real one got away, but if you see it, let us know. See, all the girls start to squirm when they have open-toed shoes on. So good afternoon, class of 2022, invited guests, and those joining us will join us on the internet and in the after tape. Congratulations to the students on the finishing the didactic portion of your degree program. I realize this year has been a steep and unmapped climb up a mountain for both you and our faculty, but we certainly appreciate your persistence and your flexibility. While your successes to date have been great, now you're going to be challenged in a much different way as you move to the real world of patient care. In this process, you'll gain knowledge, wisdom, and skills from experienced preceptors, many of which have been on the front line for over a year during this pandemic, helping patients with COVID-19, as well as more recently facilitating vaccinations. You all recall your pharmacy interview? Seems like ages ago, right? One of the characteristics we were looking for at that time was a sense of empathy. Well, you're about to embark on a year of pharmacy practice experiences where, like Hygeia, you will be using empathy while improving the health of patients that you're going to take care of, from the smallest of newborn infants to elderly patients in the community. Many of your patients will have major challenges, medical challenges, often found in rural communities. To date, most of you have been largely driven by grades. This next phase in your education, while pleasing your preceptors is still important, you will likely get more incentive from knowing you are helping people and changing patients' lives. Your year of direct patient care will challenge you in new ways to learn. While you've received deeper classroom education on therapeutics than have the medical students, it's only useful if you can apply such to individual patients by pulling all the information together rather than just pieces of information to solve complex problems. You will learn that there are many important questions that are unanswered in both pharmacy and medicine. You'll take this opportunity to offer other healthcare professionals and students from other disciplines who are part of the patient care team with a common goal: to provide the best care for each individual that you're going to encounter. So I challenge you to be more proactive than reactive in this process. Think of solutions to your patient problems well before a prescription decision is ready to be made by your team. That way, you become part of that decision process, not just reactive to a prescription that's already written. As you all likely know, pharmacy practice is rapidly evolving. In many states, practice acts will allow you to diagnose and treat some conditions. Thus, your experiential training is particularly important in gaining understanding of general medical practices. Think about patients in the context of their multiple problems rather than focus on one drug or one issue. And that'll help galvanize your education if you're going to be open to such practices. So congratulations once again, class of 2022. I've personally seen many of you already stepping up and doing COVID vaccinations in clinics, in our clinics at WVU. And I have confidence over the next year, you'll continue to evolve into be great representatives of our profession and of the tradition set by Hygeia. So it's now my great pleasure to introduce our keynote speaker, Dr. Scott Knorr, Executive Vice President and CEO of the American Pharmacists Association.
Well, I'm absolutely thrilled to be with you here today in the great state of West Virginia. Tonight, as you've been told, and as you well know, you transition from didactic to clinical work. Am I all right with my microphone here? I tend to be pretty loud. You guys can hear me all right? Yeah, I know you've had your IPPs, and they're a great start, but APPs is where you really become a pharmacist, putting together all the classroom work and applying it to actual patient care. Congratulations on this major milestone in your training. Today, in addition to helping you celebrate, I'm going to share with you some of my life philosophy. When you get old like me, you see a lot of stuff. Hopefully you get a little bit of vision. How do you define vision? I used to think that vision was a characteristic, a trait like height. You were either born with it or you weren't. And I've learned over the years that's absolutely not true. Vision is really nothing more than pattern recognition. How do you recognize patterns? You take data points, a little bit here, a little bit there. I'm in DC talking, I come here and talk to your dean, I hear something else, and all of a sudden those little data points, they sort of coalesce into a vision. So with that, I've kind of coalesced a series of universal truths of leadership and success that I'd like to share with you today. Now, some of my past residents give me a hard time because I tend to repeat myself over and over, and they've come to playfully call them Scottisms. So I'm gonna make you listen to my Scottisms here. So I don't have any conflicts disclosed, and there's no CE for this, but I do have one disclaimer that I would like to share with you. I have a vested interest in, oops, I got two mice up here, vested interest in the future of our profession. My son graduates from pharmacy school Saturday in Ohio. He's a year ahead of you. And I'm going to do everything I possibly can to ensure that he and all of you have rewarding careers where you can improve patient care without the barriers we deal with now. So this is my son in December, immunizing patients at Metro Hospital in Cleveland. Wow, I don't need to tell you, right, about immunizing. West Virginia, here you're lucky to have a state with so many thought and practice leaders. Chris Capehart ran circles around the big chains and the rest of the country by leveraging community pharmacies to immunize patients in long-term care facilities. Betsy Elwick was instrumental in getting your provider status law passed last year. My friend Todd Karpinski has been a leader in health system pharmacy for decades, advancing practice everywhere he goes. My predecessor, Tom Menigan, also a mountaineer. Ginger Scott, partner with APHA to advance our technician immunization program, and the list goes on and on. So let me start a little bit about talking about why the American Pharmacy Association, APHA, exists and how that fits into your careers and your professional development. Now you guys get the first slide with our brand new logo ever. So that's very exciting. We just launched that here a little bit ago. So this is our vision, and we really tried to live the vision. And this is obviously, I hope obviously, very aligned with your careers. Our vision, and I love our tagline, for every pharmacist, for all of pharmacy. APHA inspires, innovates, and creates opportunities for members and pharmacists worldwide to optimize medication use and health for all. Our mission is the voice of pharmacy. APHA leads the profession and equips members for their role as the medication expert in team-based, patient-centered care. So there are a lot of pharmacy organizations, but APHA is the only professional society that represents pharmacists in all practice sites. If you're a pharmacist, wherever you practice, okay, unless you run a PBM, we have your back. Now, I will say there are a lot of good pharmacists in managed care, but now hopefully, yes, I'll be able to play this video. This video talks a little bit about the future of pharmacy. I'm not getting paid by Deloitte. I saw this on the internet and I thought it was a very thought-provoking video. So I'm gonna play this for you here just a little bit. And this isn't necessarily how things will exactly happen, but this makes us think a little bit about the future of pharmacy. The one thing we know, we're gonna constantly have to innovate. What we did yesterday to get us here is not gonna get us where we have to be tomorrow.
The role of pharmacy and the pharmacist in the healthcare ecosystem is evolving as disruptive technologies like artificial intelligence and virtual health, as well as environmental, social, and regulatory factors, help reimagine a new integrated future of health built around the consumer and data. From automation to democratization of data, these drivers are accelerating the rate of evolution. So much so that in 20 years, healthcare delivery systems will be dramatically different. But as pharmacy capabilities and clinical breakthroughs advance, how will the role of the pharmacy and the pharmacist evolve within the broader care team? How will technology augment and enhance tasks as this collaboration continues? Regardless of the future path of the pharmacist, pharmacy technology capabilities will evolve in the next 5 years, all for the benefit of the patient. Like Don, who's preparing for his annual physical in the future of health. Before his visit, an AI engine flagged Don as a potential diabetic, so he receives an at-home A1C test kit from his pharmacy. His doctor diagnoses type 2 diabetes. He selects drone delivery for his meds, which are filled and packaged. Don asks his digital care plan avatar some questions about his blood sugar. This triggers an escalation from the AI to a live chat with his pharmacist. Though he's adhering to his care plan, Don's glucose levels are rising. Based on a collaborative practice agreement, the pharmacist increases the dose of medication, and an automatic notification is sent to Don's physician. Thanks to his tech-enabled care team and their data-driven decisions, Don will live a happier, healthier life. No matter where the future of health is headed, you can put plans in motion now that not only embrace technology, but center it on the consumer as new care models continue to evolve with the role of the pharmacist and pharmacy.
All right, we all want Don to live a happier, healthier life. I guess sort of the point there is that the future is constantly evolving. We're moving into a data age, and technology is going to continue to advance, and we have to be ready to continually adapt. So as you achieve this milestone today, I thought I'd give you a little background about myself and some understanding of my journey as I came to understand my professional calling. So I'm a truck driver's kid from Council Bluffs, Iowa, born in 1966. And 55 years later, here I am with you representing the most effective pharmacy organization in history. I never planned to be a CEO of a professional organization, but if you focus on being the best you possibly can at whatever you're doing, a lot of doors open. So I was a bit of a surprise when I was announced as the 13th CEO of APHA. I'd always been an APHA member since I saw the value of having an umbrella organization that represents the entire profession. But I only had so much volunteer free time because of my day job. I was chief pharmacy officer at Cleveland Clinic. And, I always tell folks, it's kind of a Scottism too, but it's not particularly relevant to you and your role, especially when you get, like Todd there, who was on the board of ASHP and is doing a lot of volunteer work. You want to do that and be involved, but if you're away from the office so much that you get fired, then you're not doing your job. So I always say, don't forget where your paycheck comes from, because my paycheck never came from APHA or ASHP. It came from the Cleveland Clinic. But a lot of folks said, who's this hospital guy who's going to be leading APHA? The dean last night asked, tell me your story, because people getting to know each other. I hadn't been a long-term highly known APHA member. So what I told him is the truth. I wasn't looking for a job when APHA called. I truly believe that for being a chief pharmacy officer, I had the best job in the world for that. At a world-class organization, I had 1,400 pharmacy employees, a $1.4 billion drug budget, facilities in Ohio, Florida, Canada, Abu Dhabi, and London. But so what I told people, I said, really, when you run a health system like Todd does, you're really kind of like the APHA of health system pharmacy. We had 19 hospitals, we had 19 community pharmacies, a state-of-the-art specialty pharmacy, home infusion pharmacy, home delivery pharmacy. And my role there was really like APHA's role. It's to try to make all of that work together to serve patients across the continuum of care. So now another thing I brought from Ohio is that, have anyone been to APHA headquarters? Yeah, we got some folks, some students. It's magnificent, the only privately owned building on the National Mall. I got a view, I can see the Capitol. If I was your age, I could throw a rock to it, but trying to get anything done there is like beating your head against the wall. Having said that, last Thursday we introduced a bill. I think we may actually have a shot. But I saw in Ohio, just like here in West Virginia, where you passed a very good provider status law, and just last week, a DIR law, states run circles around the federal government. So that advocacy I had in Ohio came with me. So it also helped me understand how to be effective. Sorry, I got a couple mice up here for these two different screens. So why did APHA recruit me? Okay, so I'll talk a little bit about some of that later in my universal truths. But one of these universal truths I'm going to highlight shortly, that's important for your careers as you move on, was success breeds success. At Cleveland Clinic, I was an outspoken advocate related to pharmacy on egregious prices, drug price increases, and PBM shenanigans in the media. So you need, in order to be a change agent, you need the courage to step out and leverage your position and title for the good of the profession. I did that better than most. I found early on, and it's still true, no one cared or cares what Scott Knorr thinks, but the media and policymakers cared what the chief pharmacy officer at Cleveland Clinic thought. And now the media and lawmakers care what APHA says. So I like to say that we're a little more aggressive. APHA was always kind of like the Canadians or the Minnesotans, you know, being very, very nice folks and wanting to play along. We are now taking on tough issues and aggressive stands on things that harm our patients and the profession of pharmacy. I like to say we're going to call balls and strikes. If PBMs, like in Ohio, stole $244 million from taxpayers from what we paid the PBMs, the managed Medicaid patients, and what paid the pharmacists, we're talking about the media. Now, if folks do good things, Pfizer, oh my God, right? Moderna, literally helping us save the world, you know, by, you know, you can talk about drug companies' prices and all, but right now, thank God, we've got J&J, Pfizer, and Moderna. So we're gonna be very vocal. These are all articles that I was quoted in before I came to Cleveland Clinic, before I came to APHA. So now, switch a little bit to you, beginning your API rotations. This is where it gets fun. This is where you put it all together. The universal truths I'm going to talk about translate into your entire life. Okay, they're for APIs, they're for your residency, they're for your job, they're for your relationships, and they're really for your life. So here's the first. In order to be successful in life, you have to know yourself. Okay, we're all odd ducks. I'm really quite an odd duck, but I really know all of my oddness, okay? A lot of you, I'm sure, have had leadership training. How many folks have done strength finders? Okay, quite a few. My strengths are focus, significance, strategic, futuristic, and related. Myers-Briggs, you want to do Myers-Briggs? Okay, good. If you haven't, you can go do it online pretty quick. I'm an ENTJ. You are what you are. It turns out that that's the highest number of those are CEOs. I don't know. There's a correlation there somehow. But with that, you have to know yourself, but also how you interact with other people, where they're coming from. Okay. So I'm an N. I'm intuitive. I get about 2 data points and I'm running down a direction. S's, sensors, have to have a lot more data. Right? If intuitive, you say, let's go, the sensor's like, oh, hold on, wait. You know, so you have to understand how you are and how you're perceived in order to be effective. The next fits into that, okay? The next part is that absolutely, in order to be successful, you have to have relationships. When you're the dean, you say, hey, everybody do this, and everyone just automatically does it, right? They don't question your orders. Right? Because you're the boss. And that's certainly not how it works at APHA. Todd, is that how it works over the hospital? No, exactly. That's right. That's right. But it's, people have to want to work with you, right? Right? They have to believe in you. And you know, I had a CEO at University of Minnesota one time, Gordy Alexander. And Gordy Alexander, every once in a while, people are always watching you, okay? Every once in a while, you see someone's true character. So Gordy, I don't know, I was pharmacy director and they were hiring some they were recruiting some hotshot urologist. How he had a prostate modeling program or whatever, and they really wanted him bad. Okay, so the head of urology calls me and says, Scott, we want you to hire this guy. His wife's a pharmacist. Can you hire her? I'm like, maybe, send me a resume, you know. And they're like, can you hire her? I'm like, well, you know, send me a resume. They want me to give her a job Monday through Friday days. My pharmacists all rotated through evenings and weekends. Do you think I would have had a lot of credibility and trust with my staff if I would have hired someone from outside for that? So I very politely told this guy no, and he hung up. And I'm not real good at academia, so I got some associate dean of the College of Medicine calls next, and hey, Scott, how you doing? How's that Vikings game? Yeah, pretty good game, right? Oh, hey, can you hire this guy's wife? I'm like, well, you know, no, that wouldn't be the right thing. He wasn't so happy anymore, hung up. Next thing I know, the dean of the College of Medicine calls. Now, I didn't report to the dean of the College of Medicine. I reported to the CEO. Same thing. Hey, Scott, you know, you watch that Vikings game, you know, all buddy. No, you know, I said, no, I can't do that. Then I'm waiting. I hung up. My boss, the CEO, called next. Gordy, hey, Scott, this is Gordy. I'm like, yeah, I kind of figured you're going to call Gordy. He says, could you explain this to me? I said, Gordy, you know, here's the deal. If I did that, it wouldn't be the right thing to do. I wouldn't have any credibility for my staff. He said, let me handle it. He hung up. The phone never rang again. He had my back. Could he have told me to hire that person? Yes. Would I have hired her? Yes. Would I have been looking for a job? Yes. The guy, I would have fallen to the end of the earth. If he would have called me to be his chief pharmacy officer when he left, I would have absolutely done it. But it's all about relationships. This is pretty easy. It's just like Gordy, right? Always do the right thing. That doesn't mean the right thing for pharmacy. Sometime when you're in Todd's position, it might be good to have nursing or medicine or PAs do something, but you have to be open to that. Okay. You can't just be turfy and grow your kingdom. You have to put it about the patient. This goes back to relationships. Here's the fundamental thing you get between nursing and pharmacy, right? Pharmacists are downstairs in the IV room. A nurse calls up and needs a dose right away. What's the most important thing to that nurse? When does she want it or he want it? Now? Why? Go up and put that nurse's shoes on. Okay. Children's hospital. They got a pediatric patient in pain or having convulsions. You got mom giving you the death stare. We don't have that in the pharmacy. Pharmacist on the other end of that phone. What is the most important thing to a pharmacist? We're pretty anal retentive lot. What before we send that dose, it's got to be what? Right. Safe. Right. Does the nurse assume it's unsafe? No, they assume it's safe. But you have to understand and have relationships. That's empathy that we talked about earlier. You have to be empathetic. You have to put yourself in other people's shoes. This now gets to being relevant. I think they're all relevant life lessons, but for you, this is tied to the next universal truth. In order to be successful, you have to have a bias for yes. What do I mean? Your preceptor comes in. There's 3 or 4 API students sitting around the computer. They're like, hey, I need someone to research this for an article I'm writing. It doesn't sound very glorious. It sounds kind of tedious. What do you say? Yes. You do a good job. Who's that preceptor come next time they have a project? They come to you. Okay. You become the go-to person because you have a bias for yes. Now, you can't say yes to everything or you won't get anything done. So you have to prioritize. But when you have a bias for yes, then success breeds success. Okay, this is throughout my career, it's throughout your dean's career, it's throughout Todd's career, it's throughout everyone's career, that when you do something good, you get more attention. Okay, I became an advocate in the media because a Wall Street Journal reporter called the Cleveland Clinic and wanted to know if we'd seen price increases in nitroprusside and isoproterenol. I said, yeah, if we use the same amount last year as this year, it cost us $9.5 million more. Success bred success. Every reporter in the country, that's a slight exaggeration for effect, but every major newspaper called, television, and I became, someone that really represented pharmacy in the media. That success bred other success. The APHA Board of Trustees said, we want someone who knows how to advocate and fight in the public. Okay, that's why they recruited me. My whole life is like that. You know, I've got countless examples of this. So just understand having a bias for yes, and that success breeds success. This is an important thing to remember. You should treat every day like it's a job interview. Okay, you're starting your clinical rotations. Okay, Some of the preceptors may be on the residency community interviewing to see if they're going to hire you. They may, it's a small world. I was talking today to some of Todd's managers, and it's like the Kevin Bacon game. I don't know, now I'm getting old. That's probably not even a thing anymore. You know, within a couple movies, you can name an actor that's worked with Kevin. That's how pharmacy is. You know, it's not 6 degrees of separation. It's maybe 2. So their chances are someone's going to look at your preceptor list when you're applying for residencies or when you're interviewing for a job. And they're saying, oh, I know them. And they're going to call them. Okay. So every day is a job interview. Right now, one of you may found some, I don't know, IT platform that makes billions of dollars. You may need a good CEO. You're like, God, that Knorr guy gave a pretty good talk. He kind of motivated me, right? This is potentially a job interview. So, you know, I think that's just a really good way to sort of look at life. Is that, and that doesn't mean you can't have a beer and have some fun. It probably means you shouldn't go crazy and be stupid, but every day is a job interview. And then this one, I think, is very relevant throughout our entire life. It's pretty simple. And it's not a qualitative statement. It is more of a quantitative statement. The more you limit yourself, the more you limit yourself. Now, if I could have never left Council Bluffs, Iowa, I'm just trying to think back. I went from Council Bluffs, Iowa, across the river to Omaha, Nebraska, to undergrad, to Germany, long story, to Omaha for pharmacy school, to Kansas for residency, to Texas for my starter management job, to Minnesota as a director, to Cleveland Clinic, to here. If I hadn't been able to geographically do that, I would not be here. Now, I have friends in Council Bluffs, Iowa, who seem to have very good lives and be very happy people. Is my life better than this? I don't know better than this. Maybe for some of them, maybe not for some. But I would not be where I am today if I now there are things, right? Maybe the most important thing, maybe you got sick parents, maybe you can't leave. That's okay. There's nothing wrong with that. But every decision you choose to limit yourself will limit you. Okay, I want to talk a little bit about APHA's plan to drive our profession forward so that you all have meaningful careers. So my son has a meaningful career, so that we all have meaningful careers. I tend to simplify things to make them easy. We had a strategic planning session, got our board of trustees and everybody together. Our top 3 issues in our strategic plan are: number 1, payment reform; number 2, payment reform; and number 3, payment reform. I'm not really kidding. Everything really leads back to pharmacists being paid for the right things. I'll talk a little bit. I got some slides, I think, coming up, so I don't get out of. So PBMs have sucked all the money out of community pharmacies. You still have more community pharmacies in West Virginia than most states, but they're a dying breed. We had 10,000 community pharmacies close in a 10-year period. It's unsustainable. Okay, that's because PBMs suck all the money out of healthcare without providing any benefit between spread, DIRs, rebates. It's really quite crazy. And so right now, I've got a couple slides here. It's not very fun to work in a really busy chain pharmacy. Pharmacist well-being is a big thing. If Walgreens and CVS got paid to have you manage their mom's hypertension, they would do that. They do not get paid for that. Okay, our system is getting exactly what it's designed to do, which is high volume and really no quality. So how are we going to do that? How is APHA going to empower pharmacists to care for patients? It's a 3-part plan. Okay, it's the federal government. Last Thursday, we dropped a bill in the House. I think maybe today, I haven't checked my email, we're dropping the same bill in the Senate. Pharmacist provider status for underserved areas. My experience in Ohio and the things you're doing here in West Virginia show how much states can do. Lots of states are getting pharmacists paid to do things. PBMs, fighting PBMs, we won a national battle, Rutledge versus PCMA last year, a Supreme Court battle that ruled that yes, states can impose restrictions on PBMs across state lines because they couldn't before. Okay, so now you guys, last 2 weeks ago, passed a good DIR bill. That would not have mattered before, but Rutledge versus PCMA now says that you can. The state level, I hired the most innovative disruptor on earth who has a data company that is exposing where all the money goes, where DIR fees, where PBMs are taking it out. Okay, so we're pushing that narrative in the media every day. At the state level, I'm hiring someone next week to help our pharmacists. He works as a clinical pharmacist at an academic medical center, so he knows billing codes and he's billing in Ohio. And He's training community pharmacists, not PGY7 community pharmacists. There aren't really such things as PGY7, but real pharmacists, how to do that. Let's see, I think I've got a state. Oh, so this here's my boom. New legislation aims to expand access to pharmacist care in underserved areas. This just came up last week. Let's see, what do I say here? In many states across the country, pharmacists are already critical members of the healthcare team and are compensated appropriately for that work, said me. It's time for Medicare to get with the program and recognize what many states have already learned. Pharmacists provide great care. So we're taking it at the federal level, we're taking it at the state level, and we're working with private insurers to pay pharmacists. Oops, let me see if I can go back up. Sorry, I got multiple things going here. All right, so this was today's quote in Pharmacy Times. Okay, what's different this time? The same bill we failed with our provider status about 2-3 years ago, but now we've had COVID. Okay, your dean has drawn up every dose in West Virginia. Okay, you guys, yeah, do you guys have carpal tunnel from giving shots? Okay, this is the quote I had. I said, pharmacy is literally saving the world through immunization, says me. You know, that's what we're doing. So right now we have this racial disparities in healthcare. Where are they closing pharmacies? Inner cities, not where I live, right? That's compounding. We have pharmacy deserts. It's a public health crisis. Our pharmacists ran toward this pandemic like the first responders ran toward burning buildings. We lost pharmacists. Pharmacists died. They didn't have masks, right? Okay, they went to work, took care of patients. We're going to cash in on this in a good way, benevolent opportunism for the good of our patients. And we're going to fight hard to make sure now is our time that pharmacists can be reimbursed so that we can, it's really a public health issue. And this was what I'm talking about there with what we did in Ohio. This is NOTAM. This is actually the cover. This isn't a pharmacy magazine. This isn't Scott's APHA magazine. It's Modern Healthcare. Who reads this? CEOs of every healthcare organization. Pharmacists move to the center of a care revolution. And this, that was just in September last year. And this is NOTAM. It's Zeke's Pharmacy in Dayton. You know, again, he's a real live pharmacist who did not do 15 residencies, and he's taking care of patients. He's improving their lives. Their quality is improving. Their hemoglobin A1Cs are better. Their time to therapeutic hypertensive medications is better. So we can do this. We did this in Ohio. We're doing it in a lot of states, and we're going to do it at the federal level. So we talked a little bit about some of the issues in community pharmacy. We need to do some work. Oops, sorry. This is an article, January of 2020. This is, I'd accepted the job, but no one knew it yet in January of 2020. And we get hit with this, how chaos at chain pharmacies is putting patients at risk. Now, again, this is not necessarily a shot at chain pharmacies. This is a shot at the system. This is a shot at the payment model. Okay, when it's all about volume, this is what happens. It's not fun to work in a busy chain pharmacy right now. I want all of you to have fun in whatever practice site you're doing. So, and then this was just this year, March 16th, overworked, understaffed pharmacists say industry in crisis puts safety at risk. So this one, just Adele Kaplan, okay, at NBC News. I'm quoted in this. Antonio Chacha is quoted in this, who works with me as well. We fed this to this reporter 6 months ago when she called and she asked us about mail order delivery when the post office was slow. You know, being in front of reporters is a relation, right? Life is about relationship. You get quoted, success breeds success. I have a bias for yes. These folks call and I work with them. Okay, so we're getting the word out. And now I've had calls with Adele and we're talking about why it's like this. It's because we need provider status. It's because we need payment reform. It's because we need DIR fixes. So we're constantly working the media. We measure that. Okay, there's measures of how many times people are quoted in the media. APHA just completely owns this space. The next group down is the community pharmacists. They do a good job. They got about half of what we got. ASHP is about a third of the hits in the media that we've got. This was just out April 21st. What's the date? It was like last week. A survey by Hygeia regulators shows stress fatigue among pharmacists at chain stores. Again, I don't have a problem with chain stores. I have a problem with the reimbursement model. So with that, APHA used to be kind of like Canada. We were very nice. Okay. We kept ourselves. We did great work. My team has always done great work. Tom Menniken did amazing work. Society in the newspapers and the physicians and the legislators didn't know about it as much as they need to. Okay. We're talking about, we're fighting hard, we're aggressive, we're throwing punches, and we're building collaborations. We're not doing it on our own, right? We're bringing people along, but we're here to play. We're here to fight for you. And what do you need to do? Support your pharmacy organizations. Be a lifelong member. APHA is working for you. Let's work together to do this. Congratulations on this major milestone and phenomenal accomplishment in your careers. I'm proud of you all. Let's do this.
Thank you, Dr. Knorr. I truly enjoyed that. It's exciting. What a great future you have to look forward to. I wish I was just beginning, but I'm sort of at the end, but I'm going to go down fighting. I had to, I'm going to make just a quick comment. The video you showed, and I thought, wow, that is amazing. When I started in pharmacy a while ago, we used a typewriter, a little tiny typewriter with a roll that we put through it, and we hand typed all of our labels. We were so far from that, but it really hasn't been that long. And the progress that we've made and where we can go is just absolutely amazing and fascinating. And I wish just most incredible successes to you in your career. That it was lovely. And you go get them. All right. Okay. So now we're at that point of the program where we're going to recognize the class of 2022, all of those who could be with us tonight. As the students come forward, I will call their name. You'll come up on this side of the stage and receive your new pin and your new nameplate from Dr. Barrickman, and then walk this way behind me down the steps and back up to your seat. All social distancing and all of those things. It is being videoed, so no pictures, so you don't have to remove your mask. I will ask that you don't jump off the stage. Every ceremony we've ever had, we have a few people who come around and go, no, I'm not going to go that far. I'm going to jump off the stage. It just scares me. So just please use the steps. All right. So with that, I'm going to ask Dr. Ashley Barrickman to get ready to help. She is the director of the skills development and she's a clinical assistant pharmacist professor in the Department of Clinical Pharmacy and your class advisor. All right, which I know you probably haven't seen her a lot in the last couple of years. So she's helping us tonight. So Colby, I ask you to stand and lead your row of two down. And Joy, if you will follow right behind, that would be great. All right. All right. Colby Ackreed, Palmyra, Pennsylvania. Mallory Anderson, Houston, Texas. Joy Apopa, Morgantown, West Virginia. Ryan Archer, Toronto, Ohio. Rebecca Arthur, Hinton, West Virginia. Mo Balkadar, Saudi Arabia. Megan Boniti, Weirton, West Virginia. Evan Booth, Elkview, West Virginia. Troy Boner, New Martinsville, West Virginia. Alex Bolby, Maysville, West Virginia. Courtney Bunner, Fairmont, West Virginia. April Castro, North Huntington, Pennsylvania. Roger Koger, Upper Glade, West Virginia. Elizabeth Conforti, Weirton, West Virginia. Algie Cook, Oceana, West Virginia. Logan Cox, Mineral Wells, West Virginia. Jessica Gaynor, Washington, West Virginia. Ashley Goday, New Orleans, Louisiana. Courtney Glasscock, Berkeley Springs, West Virginia. Ashley Haywood, Stuyvesant, New York. Katie Herrick, Wheeling, West Virginia. Samantha Hines, Clarksburg, West Virginia. Lindsay Hoke, Charleston, West Virginia. Jordan Horshaw, Harrisburg, Pennsylvania. Kara Howard, Towson, Maryland. Wyatt Kinsel, Mannington, West Virginia. Andrew Crash, Morgantown, West Virginia. Jonah Lalama, Bridgeport, West Virginia. Nicole Lewis, Wheeling, West Virginia. Nicholas Lykar, Irwin, Pennsylvania. Amy Lusk, Corrine, West Virginia. Trevor Mayfield, Morgantown, West Virginia. Hunter Moody, Smithfield, Pennsylvania. Lena Park, Glen Burnie, Maryland. John Parker, Romney, West Virginia. Kirsten Parsons, Petroleum, West Virginia. Julia Pepper, Hagerstown, Maryland. Mark Pintai, Bridgeport, West Virginia. Mary Catherine Platts, Charleston, West Virginia. Raven Powers, Martinsburg, West Virginia. Elizabeth Reitnauer, Berkeley Springs, West Virginia. Walker Rose, Webster Springs, West Virginia. Frank Sammons, Oceana, West Virginia. Emery Smith, Bridgeport, West Virginia. Sarah Snyder, Parkersburg, West Virginia. Joey Stanley II, South Williamson, Kentucky. Tyler Sturcho, Greensburg, Pennsylvania. Drew Stilgenbauer, Fairmont, West Virginia. Austin Strickland, Caro, West Virginia. Morgan Summerskill, Prosperity, Pennsylvania. Taylor Talkington, Shinston, West Virginia. Taylor Thompson, Follansbee, West Virginia. Ashley Van Camp, Wellsburg, West Virginia. Lainey Vargo, Oak Hill, West Virginia. Nicole Virtue, Wintersville, Ohio. Mackenzie Walker, Hurricane, West Virginia. Alyssa Wallace, Wheeling, West Virginia. Jordan Wood, Colliers, West Virginia. Michaela Wright, Maysville, West Virginia. Amy Young, Beckley, West Virginia. And Tyler Zim, Fayetteville, West Virginia. Congratulations once again to the class of 2022. I now welcome Dr. Barrickman to the podium to lead the class in the oath of the pharmacist.
Will the class of 2022 please rise? Raise your right hand and repeat after me. I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow, I will consider the welfare of humanity and relief of suffering my primary concerns. I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients. I will respect and protect all personal and health information entrusted to me. I will accept the lifelong obligation to improve my professional knowledge and competence. I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct. I will embrace and advocate changes that improve patient care. I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists. I take these vows voluntarily with the full realization of the responsibility with which I am entrusted by the public. Please join me in congratulating again the class of 2022. You guys may be seated.
Well, in closing, I'd like to thank all the faculty and staff and our guests who are with us today. I'd like to also thank my staff for developing the program tonight. They worked very hard behind the scenes, and anyone else who was involved in making sure that we were able to have a live ceremony tonight. It's really appreciated. Congratulations and good luck once again to the class. And we want to thank all of you for attending the ceremony. We ask that the students, faculty and staff and special guests exit the auditorium into the foyer area and maintain social distancing. We have some individually packaged Flying WV cookies out there for you to pick up on your way out. So please, they're right outside out in the foyer area. So make sure you do that. If you're going to take group photos, we ask that you take them outside. That way we don't have to have a lot of people congregating in the pylons and taking their mask off and on. So it's a beautiful day. Go out, enjoy it. And thank you all again. Take care.